Good morning to all. My name is Jahnavii and I would like to ask everyone to lend me your ears for the next 10 minutes. In modern times, with the rising population levels, pollution levels, emission of harmful gases, it has to be a priority for everyone to maintain their health and hygiene. I'm very sure that everyone is aware and terrified of the new COVID-19 virus that has led to a pandemic this year. This virus spread all over the world from the east till the west at an alarming rate. If we look closer, the main reason for the quick spread is certainly poor hygiene. We all have been educated by the government to practice certain measures such as social distancing, washing or sanitizing our hands frequently, and wearing a mask. These measures are taken since the virus spreads through touch and droplet transmission. Today, I'm here to remind everyone about the health risks that one can face due to lack of hygiene. First of all, what is hygiene? Hygiene refers to good health practices and rituals that prevent diseases and leads to good health. Thus, it mainly includes proper sewage disposal, cleanliness, and safe drinking water supply. So it includes all the activities that are done for preserving and improving as well as maintaining sound health. Good hygiene is crucial to good overall health and wellness because it helps lower the risk for diseases, illnesses, and medical conditions caused by effects of poor hygiene. However, before I speak about the health risks, I would like to start off with the importance of hygiene and ways to maintain good hygiene. Firstly, good hygiene lowers your risk for diseases and illnesses commonly spread through viruses and bacteria. Your hands come into contact with bacteria every time you cough, use the restroom, touch a pet, or touch surfaces such as stair railings used frequently by others. Failing to wash your hands and body regularly can cause these bacteria to multiply, increasing the risk for infection and other health problems. Washing yourself and staying clean can kill and remove illness-causing bacteria from your body, lowering the risk for diseases. Secondly, hygiene is also crucial for social and professional acceptance. Spending time around those who fail to demonstrate good hygiene can be unpleasant due to factors such as bad breath and body odor, and it increases your own risk for diseases and infection. Poor hygiene can have negative consequences on your social life and relationships too, including business relationships. Many employers urge or require employees to practice good hygiene and tend to hire people who look clean as though they practice healthy hygiene habits. Good hygiene is especially important to employers in the food and medical industries, as poor hygiene can lead to contamination and spread of disease. Besides, being clean and well-groomed can help you feel more confident and comfortable both physically and mentally. Feeling dirty, oily, and not fresh not only puts your physical health at risk, but it can trigger negative emotions of discomfort, irritability, and anxiety. Poor hygiene can affect your mood, your interactions with others, and the way you feel about yourself. Good hygiene can boost your self-confidence and self-esteem and make you seem more positive and attractive to others. Good hygiene can indirectly boost your success at work, in the gym, and in scenarios that require you to be at your very best. Children who practice good hygiene can avoid being bullied at school, as evidence suggests that poor hygiene is one of the top reasons kids are bullied. Parents who teach their children the importance of good hygiene instill healthy habits early on in life and prevent them from experiencing problems with bullies. Good personal hygiene habits include brushing your teeth, bathing or showering, and wearing clean clothes. Performing these habits daily or as often as needed achieves and maintains good hygiene and cleanliness. For the human body, health is a positive state where every part of the mind and body is in harmony. Additionally, it is also functioning and balancing the other parts. Thus, in other words, when all parts of the body are functioning well, the physical well-being state of the human body is called health. It is well said and proven that a healthy person is someone who has a sound body and a sound mind. Health is one of the characteristics of life that helps a person live longer. According to World Health Organization, health is a state of complete mental, spiritual, physical, and social well-being, and not only the absence of disease. If a person is in good physical state, free from any diseases, but is under constant stress, greed, tension, anger, then the person is not healthy. Now, let's move on to the main topic of this discussion, which is the health risks related to lack of hygiene. Have you ever heard of stomach flu? What you probably had was gastroenteritis, not the type of flu at all. Gastroenteritis is an inflammation of the lining of the intestines caused by virus, bacteria, or parasites. Viral gastroenteritis is the second most common illness in the US. The cause of it is often a norovirus infection. It spreads through contaminated food or water or by contact with an infected person. The best prevention is frequent hand washing. The most common cause of gastroenteritis is a viral or bacterial infection, less commonly parasitic infection. The most common causes of viral gastroenteritis are norovirus and rotavirus. Escherichia coli or E. coli, Salmonella, and Campylobacter are the most common causes of bacterial gastroenteritis. Symptoms of it include diarrhea, abdominal pain, vomiting, headache, fever, and chills. Most people recover from it with no treatment. The most common problem with gastroenteritis is dehydration. This happens if you do not drink enough fluids to replace what you lose through vomiting and diarrhea. Dehydration is most common in babies, young children, older adults, and people with weak immune system. Next, trachoma. Trachoma is a bacterial infection that affects your eyes. It's caused by the bacterium Chlamydia trachomatis. Trachoma is contagious, spreading through contact with the eyes, eyelid, and nose or throat secretions of infected people. It can also be passed on by handling infected items such as handkerchiefs and towels. At first, trachoma may cause mild itching and irritation of the eyes and eyelids. Then you may notice swollen eyelids and pus draining from the eyes. Untreated trachoma can lead to blindness. Trachoma is the leading preventable cause of blindness worldwide. The World Health Organization estimates that nearly 2 million people have been blinded by trachoma. Most blinding trachoma occurs in poor areas of Africa. In areas where trachoma is prevalent, infection rates among children under 5 can be 60% or more. Early treatment may help prevent trachoma complications. Trachoma is caused by certain subtypes of Chlamydia trachomatis, a bacterium that can also cause a sexually transmitted infection, chlamydia. Trachoma spreads through contact with discharge from eyes or nose of an infected person. Hands, clothing, towels, and insects can all be routes for transmission. In developing countries, eye-seeking flies also are means of transmission. The World Health Organization has identified 5 stages of development of trachoma, which is inflammation, followed by eyelid scarring, ingrown eyelashes, corneal clouding, finally. And the prevention is if you're being treated with trachoma with antibiotics or surgery, reinfection is always a concern. For protection and for the safety of others, be sure that family members or others who live in screened and necessary treated for, and if necessary, treated for trachoma. Finally, I'm sure everyone is familiar with diarrhea, which is loose, watery, and possibly more frequent bowel movements. Luckily, diarrhea is usually short-lived, lasting no more than a few days. But when diarrhea lasts for weeks, it usually indicates that there's another problem. If you have diarrhea for weeks or longer, you may have a condition such as irritable bowel disorder or more serious disorders such as persistent infection or inflammatory bowel disorder. Number of diseases and conditions that can cause diarrhea, including viruses. Viruses that can cause diarrhea include Norwalk virus, cytomegalovirus, and viral hepatitis. Rotavirus is a common cause of acute childhood diarrhea. The virus that causes coronavirus disease has also been associated with gastrointestinal symptoms, including nausea, vomiting, and diarrhea. Bacteria and parasites in contaminated food or water can transmit bacteria and parasitic infection to your body. When traveling in developing countries, diarrhea caused by bacteria or parasite is often called traveler's diarrhea. Clostridium difficile is another type of bacteria that can cause serious infections that cause diarrhea, and it can occur after a course of antibiotics or during hospitalizations. As a conclusion, I would like to urge everyone to practice good hygiene as a preventive measure from all these diseases outbreaks. I hope that the main idea of my speech to create awareness on health risks faced due to poor hygiene such as diarrhea, trachoma, and gastroenteritis is reached. Thank you for your attention.